really understand the different opportunities that the industry provides for optometrists. And when I am probably not very clear, or if the internet is lagging behind or something on that lines, please feel free to stop me. And because I'm in the presentation mode, I'm not going to see any of the raising hands or comments. So bear with me with that. So before I begin the presentation, I would certainly start by saying that I'm certainly expressing these from my own experience, right, and from my own knowledge. And this is certainly not representative of what my employer, AbbVie, or anyone on this behalf is perceiving this to be. And I don't have any financial conflict of interest with regards to this topic, and there was no financial remuneration that was provided for this presentation. So those are my disclosures to begin with. And I also want to set the ground for what this presentation is going to be, right? So the title is Opportunities for Optometrists in Industry. And I certainly don't want this to be a debate between an industry role versus an academic career. And there are different forums and platforms that you can go for, and everyone has an approach and attitude to it. And this is certainly not the forum to debate between one versus the other. There are merits and demerits of each of this, and we will not go there today. And this presentation is, I'm trying to make it as detailed as possible, but by no means this is exhaustive, right? So the way I see it is, it's just a sample or a starter to kickstart your appetite or research, right? So from what you hear with the discussion today, this will probably be the necessary ignition force for you to do your own research and then understand more opportunities. So that's how I see this presentation as. And finally, I'm certainly not in here to promote or endorse any particular company or product. And the reason I want to divulge this is you will see in the next couple of slides, I speak about different opportunities in different industries and different roles. And when I mention those, I'm not trying to promote any specific company or product. So those are my expectations before I start the presentation. Uh, so I know Gopi spoke about this, so I just don't want to spend too much time on this. My journey involved different phases, being a student, being in clinical practice for a couple of years, then pursuing academia by doing PhD and doing postdoctoral research, and finally landing into this industry role. And I have been with this company, Medical Science Liaison in AbbVie, for the last 2.5 years now. So I have been there in various roles as a student, as an clinician, as an academician, and now I am on the industry side of things. And the reason I bring this up is, of course, each one has a different trajectory in their career. So you could think of someone who chose to just jump directly from clinical practice into an industry role. Or you could even think of someone moving from a bachelor's or a master's in optometry to directly into an industry role. And someone who totally skips a clinical practice before transitioning to any of these roles. So whether you take a route which involves clinical practice, which involves doing an advanced degree, be it as master's or PhD or postdoc, is certainly a very, very customized one. And it's not one size fits all, right? So just because someone did that kind of a journey, it doesn't mean that you have to exactly do that journey, which is being in clinical practice or doing a PhD or doing a couple of postdocs. So whatever your pursuits and passions are, you would certainly do what is appropriate for that goal. So I just want to put that in expectation in here. So just because I'm showing this career journey, that doesn't mean this has to be the only option out there. So before I begin the presentation, I actually wanted to kind of engage the audience, right? So I would love to understand the audience pulse and audience background, so as to say. So what I'm going to do right now, if it allows me, I'm going to try something that's hoping this works for me. I'm going to paste something in the chat in here. I'm assuming chat is something everyone has access to. So what will happen, I will still share the screen so that you can see the instructions in there. So this is a way to participate in a poll. So I'm trying to conduct a poll in here to understand what the audience background is. So you will see the link in the chat in just a couple of seconds. Hold on to this. I will put the link in the chat now. And once you have that link, you can use the link to open either via phone or laptop or PC. It doesn't matter. It should open well in all the platforms. And you're going to type your preferred name, however you want to be identified as. And you're going to put the response within 60 seconds. Okay. So let's see if it works. I'm going to stop sharing in here and I'm going to share the link. And hopefully that link came and once you click that link and once you type in your name, you should be able to actually respond to that question. I'm going to give a couple of seconds. Actually, it's 1 minute. So I'm going to give 1 minute for people to respond. And if in case you have trouble seeing in there, I see a couple of options coming in already. I think some of them were able to put their responses. I'm not going to say what those responses are, but in about 20 seconds, I'll be able to share that results with you. Keep giving your responses. What comes to your mind when someone says an industry role? That's a question in there. I'm verbalizing for those who are not able to probably follow this through with the link. So the question is to understand what comes to you when someone says industry role. Last 10 seconds to put in your responses. We have a couple of responses in here. And I think with that, the poll probably would have closed. And let's see. So thank you very much. I think some of them also responded through the chat. So I think sales is one option, related to marketing is another option. So I'm going to share what the responses were. So tell me if everyone can see this all right. So this is what people basically gave as response, right? So I think most people gave the response as marketing. Some people called it as work, difficult people working, several interactions, product, independently, satisfaction, development, challenges. So there are different things that come to your mind when someone says an industry role. I think the most common theme, because it's highlighted in a bigger font, I guess most people think of industry role as marketing. And of course, there are different opinions about what these industry role is. So I'm going to stop sharing and then I'm going to go back to the presentation. And the reason why I did this, as I said, I wanted to understand what the field, what the audience feel about in general about the industry role. So tell me if you can see my screen all right again. You can see my presentation all right, Gopi?
Yep.
Okay, perfect. So, and I'm transitioning from that to what I was always told about industry, right? So, it's often seen as an location that is forbidden and often seen as something that is dark and often seen as something that people have a negative connotation about. And as I said, I'm certainly not in here to debate between the different positions and different roles and the merits and demerits of each one of them. But you will have to realize that there are so many opportunities out there, and industry is just one of them. So it might be an opportunity that clicks for few people, and it may not be an opportunity that works out for them. And if that's the case, there are always options that are out there to explore. So it's not like you have to choose a path and then you have to stay in that path. We can always make course corrections. So having said that, for the next couple of minutes, I'm going to be actually kind of presenting about a mini research that I did for my presentation today, right? So when the question was to present about different industry opportunities, I did my own research to understand what are the India trained optometrists. Again, when I say India trained, I have a star or asterisk in there because intentionally or unintentionally, I did include some of my colleagues from Houston and elsewhere who are trained in Nepal too. But in general, Indian subcontinent trained optometrists, where are they with different industries across the globe? So this is the research that I did in the last couple of weeks. So I'm going to give you a glimpse of what the outcome of this research is. And that is going to help us understand the different avenues that you have in industry with optometry as your training, right? So this is what I found. This is again looking at 64 different optometrists who are trained in the Indian subcontinent. And I'm not saying we only have 64 optometrists out there. Maybe there are 600 optometrists out there who are trained in Indian region and then eventually scattered across the globe. But I just chose to conveniently sample a subset of them. So I'm not saying this is representative of the true population, but I think this is very well reflective of what the reality is, or it is very close to the reality. Let's say it that way, right? So this is the distribution of where all the optometrists are. So you have the medical device industry taking a bulk of the share, about 30% of them. And you have pharma and medical device industry taking about 23% of them. We have CROs or contract research organizations, and the biotech industry taking about 14% of it. Pharmaceuticals by alone itself is just 10% of it. And there are also people who are choosing miscellaneous careers, and non-profit organization is also making up a minority of them. So some examples of some of the medical device industries, I'm listing the names in there. Some of them might be familiar and might ring a bell to you, and some of them are probably new to some of them. The pharma plus medical device is dominated, at least in the eye care industry, by two giants, Alcon and J&J. There are several players who are in the biotech and contract research organization space. Again, I'm listing all these names. I'm not going to read all of them in there, and some of them are more popular and more recognized than the other. Likewise, listing some of the pharmaceutical companies that has a big eye care presence, and also the 13% of the optometrists chose to do something that what I categorized as miscellaneous. Again, doesn't mean they are doing something that is different. It just means I couldn't just bucket them into one of these categories. And when I say these categories, this is not like it's something that is written on the wall, right? So this is just a category that I came up with to classify the different roles. And finally, nonprofit. Some of them also work for some of these hospital systems that are generally classified as nonprofit. I also list them as industry role because they are different from a traditional academic setting. So those are the results of this mini research which I did. And in the next few slides, you're going to probably see a good snapshot of different individuals, different optometrists who are in these different companies in these different roles. So I'm starting with the most common industry, which is a medical device. And I'm starting with people who are in medical device industry in India. And you have several names listed in there. Again, I'm not going to go into the details of who these people are and what their backgrounds are and what they are up to. And the reason why I'm spotlighting some of these individuals this way is to give you a flavor of the different kind of roles that is possible with an optometry background. And all of these people that you see on the screen have been through an optometry program. Whatever their school is, doesn't matter what their schooling background is. They all are trained as an optometrist and went on to become take up different roles in all these medical device company. On the top row, SLR, which is a stronghold in Indian situation too. On the bottom, I'm showing a couple of spotlighted profiles from Zeiss. And again, continuing on with medical device, again, highlighting and spotlighting some of these optometrists by training who went on to assume these roles in different medical device company. And you will see there is a real depth and breadth of experience with these roles. So not all of them are pursuing research. Sometimes it's a research role, and sometimes it's a role that is not hardcore research. So I'm giving some of the examples in here. So I was telling you how not all of them need to be research, right? So you see here the example in here where Ukti Ora, who is an optometrist by training, went on to pursue a career in marketing and marketing management and marketing strategy, which is different from a traditional role that many people think of in industry as a vision scientist that is shown here on the left. And there are roles that involves people in clinical affairs and in medical affairs role. And these are some of the examples now from people outside India. So we started with some of the optometrists who are trained in India, but also were employed in India. But these are the examples of optometrists trained in India, but eventually moved out to pursue their industry roles. Again, these snapshot of profiles are just to give you a flavor of the different possibilities that exist within the industry. And all these profiles are at different stages of their industry career. So someone like Aishwarya listed here on the left has about 2 years of an industry experience, as opposed to someone who is with longer period with supervision. For example, Subham and Bhaskar and Sanjeev were also with the industry roles for a longer time. So I just wanted to spotlight a couple of profiles, and more importantly, I wanted to use this as an opportunity to tell you the different designations and the different roles that you could get in industry as an optometrist. So I'm going to continue on unless there is something that came up in chat and you want me to pause. Otherwise, I'm going to continue on with some of the sample profiles in there. So we are moving away from traditional medical device company to what I have called this as pharma plus medical device. And what this means is they have a pharmaceutical product, a drug. It could be a topical medication for glaucoma. It could be something for dry eye. So they do have something that is pharmaceutical in their pipeline, but they are also a medical device company because they have a medical device. It could be a surgical instrument, it could be something else. But some of the profiles that are classified as pharma plus medical device. Again, I'm starting with some examples on top left, Vishwa from India, and then a couple of examples elsewhere. So I'm showing example from Canada on the middle and example of a profile from Australia on the bottom. And Alcon has a village of India trained optometrists. So I am going to apologize in advance for not spotlighting some of the profiles who I know as part of Alcon and who I know as part of other industries. So the only reason I'm spotlighting only some of them and not all of them is purely for space reasons. So I'm listing some of the unlisted names on the bottom and there. But the reason why I'm highlighting all these profiles again is to show you the diversity of the different roles, the designations that you see in industry. Two, you will also see the diversity of location. Not all of them happen to be role based in US. Certainly, there are opportunities in India and non-US locations. And three, I also wanted to show you that there is a really good diversity in terms of experience and gender. So there is not much that is stereotyped in terms of what the industry opportunities are. Again, changing gears to the next industry, which I want to showcase. CRO stands for Contract Research Organization. So some of the larger pharma outsource their research or some aspect of their research and data analysis and data collection to an external organization, which is referred to as contract research organization. And biotech, as the name says, involves using live organisms as a therapeutic approach. So I'm showing two examples of biotech profiles in there. Both of them happen to be in US, but again, the common link there is both of them were trained as an optometrist in India and eventually chose a career trajectory to be in this role with these biotech companies. And on the right, I'm showing 5 different profiles for different CROs, contract research organization. Something that most people think of in a role as in CRO is being a medical writer. Clinical research associate or CRA is again usually seen as an starter or a fresher kind of role, and then eventually going up in the ladder with CRA2 and principal research associate and so on. And these designations, I have to say, is very different across different companies. So what might be a CRA1 in one company might be very different for the designation in some other company. But without going into those details, the reason why I'm providing a snapshot of these profiles is to again illustrate all the possibilities and different roles that are there in the CRO industry. This is something that I am part of, pharmaceuticals, and there are a couple of profiles that I have highlighted in here. Again, I think all of the profiles listed here, except Naganathan, is based outside US. But the point again here is the roles are in different domains of industry. So you see someone who is part of clinical development, Shubha, and you see Lakshmi, who is part of hardcore research and development R&D team. And you see Abhi to be part of a clinical science team, and also people who are part of medical affairs. So there is a real variety or the real really broad career avenues that you have in industry, and specifically in pharma as an industry. I think this is last but one with regards to the different snapshot I wanted to show. So again, as I said, miscellaneous does not mean this is less chosen. I just think I couldn't bucket them into the buckets that I already have, and that's exactly why I call this as miscellaneous. And perhaps these are people who have been slightly taken the road less traveled, so as to say, right? So for example, Madhu is part of a Magic Leap team and works as a principal research scientist. And that's slightly different than a traditional vision scientist or an scientist that you see in an R&D role. And people have branched on to do different roles after doing their optometry degrees, right? So you can think of choosing a business career and a project managing career. Malini has went on to become analytics developer. And you also see people who are part of clinical data management. And you also see very, very different experiences in the totally different field, like fashion and beauty arena. And you also see someone who is part of marketing. So my goal in here again is to really provide you a glimpse of all the possibilities that come with your optometry training, whether it's a bachelor's or it's a master's or an advanced degree or an MBA or an NPH, regardless of where you want to branch out to. I think these are some of the potential avenues you could think of. And lastly, I will leave with this nonprofit snapshot again. The common link, all of these, again, in this case, all 6 happened to be female. So all 6 females had their career as an optometrist or trained in optometry school, and then went on to choose and carve a career and carve a trajectory of their own to be wherever they are in their professional journey now. And I don't want to spend too much time speaking about all these specific roles, because I am certainly not the expert of all these roles that people are doing. and I would certainly leave it to the experts to speak about it. So if you are, for example, interested in a career in hospital administration, you know Ranjini will be the contact who you can basically either connect with LinkedIn, or you can reach out to in whatever forum you're comfortable with, and then speak about the role and understand what this role is. And then he or she who is in that industry role will usually be in a position to give you the guidance as to what they did and what they recommend. So, we have been talking for some time, so I'm going to break the monotony in here just to understand if I still have the audience with me, right? So I'm going to stop sharing the screen, and if you have the link in there, it's the same link, and I believe you should be able to use that link for a different question now. And I'm going to read that question. It's the same link. So it's the same link that you use, but the question is different. And the question is, what degree or qualification is necessary to get into industry roles? So like last time, we have about 35 more seconds, and I'm waiting for people to chime in their responses. I'm seeing some of these responses already. So we have 30 more seconds. I'm repeating the question: what degree or qualification is necessary to get into industry roles? Last 5 seconds. Okay. So I'm going to share the screen in here so that we all can see the screen. Give me just a second. So, okay. So tell me if you can see the screen. And so 54% of them felt bachelor's is enough, and 23% felt some master's degree is needed, MOptom, MPhil, MS, MPH, or MBA. And 23% equal numbers felt OD or a PhD, a doctoral degree is needed. And thankfully, no one chose the last option. You just need connections or recommendations. But having said that, I included that to understand what the audience feel, right? So I think most of them feel bachelor's, a BS or a BSc is enough to get into industry role. And let's just see what I have from my own research. So I'm going to continue showing my presentation in here. So tell me if you can still see my screen. I'm going to share now.
Yep.
And that should be back. Yeah, perfect.
Yep.
Perfect. Thank you. So I am finding the cursor. So this is what, this is again, I'm not saying this is an really a robust research, because this is a research that I did based upon just 64 samples, the 64 optometrists trained in India, and that's probably 1/3 or maybe 1/4 of all the optometrists who are out there in industry roles. So it is just a convenient sampling. But having that disclaimer, what I saw in those profiles, which you also saw as a snapshot, majority of them had PhD, but there are clearly people who had some kind of a certification. It could be a certification related to a data science kind of a certification, or a project management, or a hospital administration kind of a certification. There was equal number of people who had master's and bachelor's degree. So 13% had master's degree, 13% of them had just bachelor's degree. A really small fraction had a double doctorate, a OD and a PhD. Again, a grain of salt for these results, because this is just a convenient sampling of 64 optometrists, but that gives you a picture of what the industry roles are and where the opportunities are. And finally, this I will promise that I will not bore you with the research that I did, right? So this is the last of the research that you're going to hear from me. And I have a disclaimer there that there is an investigator bias in this because I am based in US, and therefore maybe my LinkedIn profile and my LinkedIn connections are primarily based in US. But having said that, I would like to think I do have connections across the globe, but that may not be the case. So having said that, where are the optometrists who are trained in India in different industry roles in terms of their location? 60% of them roughly in US, and 20% of them in India. Australia and Canada takes up 11%. And I just bunched it as others for things that are not falling into this bucket. But again, there is a clear investigator bias in getting these results and interpreting these results. So I just wanted to say that. So that, I believe, was the last slide which I wanted to speak about before I jump into the questions. So I'm going to see if I can see you all as I'm presenting. So I'm going to start by answering the questions that came to me because I think Gopinath was kind enough to send me those questions that came to the portal before the presentation. So I'm going to start answering those questions. And I think I can still continue to share because I have my answers listed in there. So I'm going to share my screen as I respond to those questions so that you can also see what those questions are. So tell me if you can see those all right.
Yeah.
Okay, perfect. So as I keep answering these questions, if there are more questions that come up, please, whatever is the appropriate way, whether it's a Q&A or the chat, whatever the organizers feel appropriate, they can certainly handle that through the live questions. But I would love to first answer the questions that were already submitted, right? So I'm going to read some of them, and then I'm going to be quick because I know we are 40 minutes past. I think it's 7 or 8:40 in India, so we have just 20 more minutes. So let me be quick. So what is the best approach to move to industry after PhD, or how to participate in industrial setup during PhD? I think during PhD, I think using the summer internship, some of the PhD programs and some colleges do allow individuals to participate in summer internship or a collaborative project during your PhD or doing your postdoc, where you collaborate with the industry for their research. So that would be the great opportunity when you are doing a PhD or a postdoc. And what is the best approach to move to industry? I think I showed you why a LinkedIn is a powerful tool to really understand their career trajectory, to network, and to certainly use the network to find what your calling is and where you want to go. But surely, I think it's easy to say expand the skill sets, but I think whatever that role of all the roles that I highlighted and that I kind of snapshotted now, whatever you think is your passion is, and that role might call for a different set of skill set. For example, of course, a career in data science will certainly require you to have some programming background or programming knowledge, whereas some other career, for example, working with non-human primates or animal or basic science research might require you to have a deep knowledge of biology and interest in clinical sciences. So the second question, are there any extra qualifications or skills that are required to upgrade to be in industry? So I just say it as a qualifying statement in there. So I know there are people who think certificates are really a value addition, right? So there are different certificates out there, Coursera, Udemy, and different universities, including Harvard and several universities, offer certificate program that are tailored to take you closer to the dream role that you're thinking of. And this dream role need not be realized with just one career change or career role, right? You could eventually be preparing yourself to that role or a position in industry. So I believe really upskilling yourself at all points in your career by doing the appropriate certificate programs and getting that appropriate training is really the added qualification that someone can do. And in terms of skills, I think besides networking, I think communication, both scientific and clinical communication, and industry is big on looking at the managerial skills, either managing people, managing resource, for example, managing time. So those are some things that are really valued in industry. And finally, have it as self-advocate. I think you have to be your best advocate, right? So if you don't have the faith in you, and if you can't advocate and market yourself, it is very tough for someone else to vouch for you. So I think you have to be your self-advocate for meaning this is true not just for industry role. To be honest, that's true for anything in life, but more so for an industry role. Third question, is there any specific jobs in industry for PG scholars? What are the jobs that are eligible? Only PG, not other than industry. I think all job description, JD's job description list, usually by saying what do they need, like bachelor's plus 10 years, master's plus 5 years, and PhD plus 3 years. And those 2, 3, 5, or 10 are the extra years of experience they need you to be in a clinical role or in a research role. So I think my short answer is most of the job description allows for anyone, any degree, bachelor's or master's or PhD, to be part of it. The only difference is the years of experience needed. So if you just have a bachelor's, maybe you need 10 years of a clinical or in research experience. If you have master's, maybe you just need 5 years. And if you have PhD, maybe you just need 3 more years of experience. So for most, for all qualification, I'm not saying all qualification need an advanced degree, but there are certain jobs that are listed there that require an advanced degree. The fourth question, I think someone who knows that I used to work on hereditary retinal diseases and gene therapy has asked this question. So Spark Therapeutics brought in the first approved treatment for Leber's congenital amaurosis, RPE65 form. This was approved in US in 2018. And as many of you know, Novartis is marketing this outside US. It's still not there in India. And unfortunately, I don't have the timeline of when that is going to be available in India. But having said that, the problem with gene therapy is it's very, very specific to the mutation. So it's not like it's going to treat all forms of LCA. It's going to specifically, at least this one, Luxturna, which is a brand name, or Vortigene Neperovac, is going to just manage the RPE65 form of the disease. So it's not a cure for all forms of LCA, and that's the downside of gene therapy. But having said that, I also list in there how India is certainly making progress in the cell therapy, which is slightly different from gene therapy. And iStem, which I believe is Bangalore-based company, has induced pluripotent stem cells for dry AMD treatment. And they were in news a couple of months ago. So certainly there are novel treatments that are either developed in India or going to be part of Indian therapeutic landscape soon. But right now, there is no gene therapy that is approved in India, unfortunately. So fifth question, need to know about opportunities in optometry in foreign country. So I think my answer to that was you always have clinical practice as an option. So Saranya is a great example of someone who was practicing in UK, and then there are several people who are trained in India with an bachelor's in optometry degree, went on to get an OD degree, which is Doctor of Optometry. The degree in US is called OD, and there are several equivalent degrees in different parts of the globe. So usually there is an equivalent degree or an extra training that is required for you to be in clinical practice. Industry is certainly an option, and academic research is always an option. So I see a lot of questions, a lot of chat pop up, so I'm going to go as fast as I can. I think I need to learn to be brief. So, what are the opportunities after PhD abroad? In academia, I think postdoc with or without funding. In US, it's in the form of K99 grant or private grant. Arti, who is an India-trained optometrist, is an example that I can think of who got the K99 grant for a postdoc and really setting up to be an assistant and associate professor, tenure track professor. In industry, just gave different examples of all the opportunities. So I think my presentation did answer some of it. What should optometry internship students focus on? I think it depends upon the goal. I think I always think my strong suit is my clinical acumen. So I think you're always an optometrist by basic training. So you really want to hone in the clinical skills. There is no shortcut to that. I think you have to excel in your clinical acumen. And then you can broaden your exposure to different subspecialties. For example, if your interest is in contact lens or in dispensing optics or in low vision or whatever that subspecialty is for you to be exposed to, I think that's an opportunity to do that. Eighth question, what role optometrists play in eye safety and health? I'm going to defer that question because I am not the expert to answer that question. I know stalwarts like Dr. Santanam and KK are certainly the better person and really, I don't want to misinform. I think I would defer that question to the experts. Role of MTech in ophthalmic engineering. That's an interesting one. I didn't hear about this. Again, full transparency. I just don't want to act like I know everything, right? So I don't know much about it. So I'm going to pass that. But I would just say, think of what would be your goal or what would be your short-term and long-term goal in choosing any kind of a degree and any kind of career, right? So how is something that you're doing today setting you up for something on a shorter run, like 3 to 5 years, and something on a longer run, eventually 5 to 10 years? And certainly think of it as the skills that you are developing as you are gaining these experience. 10th question, opportunities of optometry in abroad. I think we spoke about it. There is always an opportunity for being involved in research. And I know there are roles that are not directly involved with research, hardcore research and clinical practice, what I call as clinical support roles and analyst roles, which are somewhat related to clinical care, but not really seeing patients day in and day out. Number 11, can you explain abroad opportunities and their qualifications? I think just gave some examples. The qualification really varies, but I want to say not every industry position requires an advanced degree, but there are some positions that 100% require it. Medical science liaison is one of them. You need to have an D degree, which is either an PhD or a PharmD or an OD or certainly an MD. So these are the people who get to be medical science liaisons, but those are just few. Abroad opportunities as an academician. Always MS and or PhD, depending upon how much you have it in you to last that long, because PhD, at least in US, is anywhere between 4 to 6, 7 years, sometimes even 8 years. Elsewhere, the PhD is shorter, could be 3, 4 years in Australia and Europe, but again, depends upon what your personal preferences and what your personal situation is. But I strongly encourage the budding optometrists and budding talents to really consider non-optometry masters or PhD, like a PhD or a master's in neuroscience or a medical imaging or genetics, for example. So these are somewhat related to what our optometry training is, but certainly not a classic PhD in vision science or a master's in vision science, because that really broadens your avenues for what you can do after your degree. Need some ideas for individual practice. So again, I'm not the best person. I'm listing a couple of names in there. My batchmate Savita, who is now a clear lens expert, Premal Soni, Sanjay Mehta, who has been doing this for a really long time, Mehul, Sachin, and there are many more examples. Again, I'm not just saying these are the only examples, right? So there are so many more people, and this is just Chennai as an example. And there are so many other people who are successful in their individual practice and eye clinic, but I am not that person, so I should not be even speaking about this. About the best career objective of optometry, I think, meaning if I understand this question correct, I think it's always about finding your passion or what the dream is, right? You get to design your path or your trajectory, and every path has an opportunity. So as long as you are willing to take that path, and even if it is a path that is not often chosen by many people, as long as you enjoy what you do and you are always learning, and more importantly, contributing, whether contributing individually or as a team, I think that's what is the objective of any role would be. Post COVID changes, and what could you do to be relevant? I think more than COVID, meaning in my mind, of course, COVID is there and COVID was there, and whatever things are with regards to your country and your region. I just think it is the artificial intelligence and the innovations in technology that is really changing the healthcare. So more than COVID, I think it has become more important for us to be relevant to the current day and time. I know the previous speaker was all about AI imaging and all that in the previous Inspire lecture, but I certainly think tech literacy is where I think we all need to improve to be relevant. So did I jump something? So 16, I think I didn't cover this. So what are the opportunities, particularly in regions with limited access? I always think there is a huge scope for optometrists to increase the awareness in the community, increase the referrals, and certainly an opportunity for telehealth. But having said that, I have not traveled that route, so I would stop there, and then I would certainly start by looking at your network, whether it's LinkedIn or it's word of mouth or whatever your preferred way of searching for information is. Seek that information, and in this day and age, the information is available to us with the press of button. I say that because 15, 20 years ago, when people like me and someone even who boarded the ship before me, things were not available at the press of button this easy. 17. What are the current trends and advancements in optometry? How can optometrists stay updated? I like this question. So I think there is not one particular channel or one particular location that I think is important. I have a slide note in there. So if you think of, meaning the omni-channel is a buzzword. Omni-channel refers to multiple channels gaining information and receiving inputs from different streams of inputs, right? So always think of webinars, podcasts, CME, CEs as the opportunity for you to stay current. So if you are a big fan of LinkedIn, choose LinkedIn. Twitter, Twitter is a big thing. So Twitter is a huge platform for medical exchange. I think that is LinkedIn is where I get all the updates with regards to the eye care industry. Follow people in LinkedIn, even if they don't connect to you, you can still follow them. It's not like they have to be connected to you for you to really follow them to understand what are they speaking about and what is happening in that field. ResearchGate is another platform where you can follow the work of other researchers so that you know what's happening in that. There are different subscribing platforms like Vision List is one which I can think of. You can subscribe to several e-table of contents for different journals, IJO, RO journals, or any journal, OVS, anything that you can think of. So the e-table of content alert comes every week or every month so that you know what's being published and what's the hot topic in the field. Practice Update is one website that I always go to get updates on most significant articles that came out in that particular week, and it spans across the breadth of optometry and ophthalmology. And depending upon what your passion is, if your passion is glaucoma, then maybe you can subscribe to certain specific ones, but that's a good platform. I have written Retina Today and Glaucoma Today. So these are magazines that are specific to what I do currently because I work in both glaucoma and retina teams. So I subscribe to them. LVPI actually has I think it's an monthly communication that comes out of LEPI, which communicates all the scientific updates that are happening with their institution. And for podcast, again, I don't want to just give you the laundry list, but there are so many podcasts out there that can keep you stay up to date. And let's see, we are in 18. So yeah, we're doing good. I think 3 minutes for 3 questions. What are the most important in-demand skills and specialization for optometrists? I think clinician scientists, being a clinician as well as a scientist is like, I'm going to say, a great combination that nothing can trump it. So if you are a clinician by training and also a scientist, I think you have the best of both worlds. But besides that, programming, I have listed artificial intelligence, health economics and outcome research is something that I pursued recently. So this is my short-term memory bias, which is coming in there. Any specialization and certification in business and management and communication is certainly useful. 19, what are some opportunities in corporate as a whole and in the area of contact lenses? So corporate as a whole, we spoke a lot about it. There are different roles: medical affairs, R&D, and commercial. So I think I had an illustration in there. So this is how people generally call the functional pillars of an biopharma and medtech industry. There is a medical affairs role. There are roles in commercial side. There are roles in R&D. And on the right, you are seeing an illustration to show the different roles and subfunctions of medical affairs. Again, I don't want to go into the details. The bottom line is there are certainly different opportunities in the industry. And specifically with contact lens being myopia, being a pandemic, there is a huge push for using contact lenses as an approach to control myopia. Discussion for some other day. I'm not going in there. Role of optometry students in manufacturing. I can only think of quality control, but certainly not my expertise. So think of connections in SLR, Hoya, and Zeiss, and then utilize those connections. Oh, I didn't realize we had 25. Sorry. So I think 1 minute for the 5 questions. So what is the scope of optometrist? I think I gave you example of R&D commercialization. So I'm just going to pass that 21st question. So future optometrists. So I told you this, right? So always think of pursuing masters or PhD in a non-optometry field too, like it could be neuroscience, genetics, whatever that is. Imaging, telehealth is probably something that I see a big opportunity. Biometrics and biomarkers kind of align with the last point, which is the personalized health aspect of it. So I think that is where the field in general, the healthcare in general is moving towards that. And certainly eye care, optometry and ophthalmology is not lagging behind much. I know we are on time, so I'm going to stop sharing unless Gopi gives me the permission to continue.
I think you can continue. We can have another 5-10 minutes of time.
Okay, so
Yeah.
3 more questions. How do you go abroad to work and study? I know that's a really large answer for that question, but again, it boils down to narrowing down your options, right? There are so many options with regards to location and degree. Utilize the network, form a network if you don't have one. Again, need not just be LinkedIn. When I say network, it's not always a network that you have or create by LinkedIn. There are so many platforms that you can connect and talk to people with. Certainly understand the requirements of that particular institution. It should be institution, not intuition. And certainly there are differing qualifying examinations depending upon the country. It could be GRE, TOEFL, IELTS, depending upon the country that you're thinking. You have to certainly put in an application. There is an opportunity to get the scholarship for some, and sometimes there is not much scholarship. And the last big thing is figuring out the visa situation. So these are all the steps that you need to figure out before you go abroad to work or study. But no one should be thinking of this as an opportunity to do the same thing again, right? Because as most people say, we don't want to reinvent the wheel. People have already done this and utilize anyone. Again, need not be someone from the same institution that you are part of, need not be someone from the same state, same country. I remember after my graduation from Houston and after my postdoc days, it doesn't matter whether someone's from India or whether it's someone is trained in certain optometry school. really the internet has brought everyone to the same location, and you could really reach out to anyone who you think is in that role and in that position. And most people are willing to give their time. 24, for direct PhD admission, what are the things required? Do we need research optometrists? I mean, research is certainly looked favorably. Let me say that way, right? So it's not must, but if you have pilot projects, if you have a research exposure, and if you have presented, and if you have any kind of obligation, those profiles are surely looked favorably. I am not going to deny that. But having said that, it's not must. So we are at the last question after this marathon, and that could be, what could be the various opportunities after a bachelor's degree in optometry apart from private clinical setup? So again, really depends upon what your passion and the short term and the long term goals are. I really can't generalize all the opportunities, and we saw different snapshots of opportunities that I presented to you. If you are not interested in clinical practice or higher study, then surely consider tangential roles. Like you could consider certification, pursuing a management degree, public health degree, epidemiology, healthcare managing, marketing, and several other roles that are kind of tangential, but not hardcore clinical practice or hardcore academic research. So I will stop sharing, and I will see if there are any questions in the chat that I can answer. Preeta has answered some question about MTech in the chat. Thank you, Preeta.
Preeta also has a comment which says, in India also optometrists are now becoming innovators, entrepreneurs, establishing their own companies, and they've basically started hiring those with research background.
Exactly. I mean, I think, as I said, being a clinician scientist is like the best of both worlds. So if you are a clinician and if you also have some research background, whether it's at the master's level or getting an advanced degree, I think that's the most valued commodity in any healthcare industry, but more so in our eye care industry.
I mean, so Dr. Sneha Babu from New Jersey.
Yes, Sneha is my colleague.
Yeah, I know. I spoke to Sneha when she did one of these live talks that they had in New Jersey. So I was listening to her, and she speaks very highly of you, by the way. And so I was just listening to her career trajectory, and it kind of aligns with what you say. Do something different as well. She did her optometry, then her pharmacy, and then she got into AbbVie. So
exactly.
I just wish people would have the courage to sort of explore these different avenues.
Yeah.
So Gopi actually brought a student to me a couple of days back saying, my parents are making me study optometry, but I'm interested in programming. So we were giving him so many different opportunities that were available if he could actually skill himself with the programming skills, opportunities, and then get into what he wanted to do with optometry as a backup. This is your starting first step, and then go forward. So, your talk was so beautiful. It gives so many different opportunities. Like I was telling you before we started, Arun, I just wish we knew there were so many different opportunities and things like that.
I agree.
When we started, it was a one-way street, and we all did that. So awesome, really.
Yeah, meaning I have to say, thankfully, meaning in this generation and this world, the information is certainly available in a click of a button, right? But I think it's important for you to know the different avenues and certainly utilize them, because there is as much information as misinformation. So you need to be that person to decide what is the truth or what is that reality, and that comes by certainly getting that information from different avenues. So even though I spent a lot of time snapshotting the LinkedIn profiles, I'm certainly not saying LinkedIn is the only platform, but I certainly find so much value in going to someone's profile in LinkedIn and then understanding what their career journey is, what all certification they did, for example. maybe they did some certification that are paid. Some of them are available in LinkedIn. And I always find value also in seeing not only where they are and where their mutual connections are. So I think there is so much value to utilize LinkedIn as a platform for certainly academic pursuits. But again, LinkedIn is just one platform. I can keep speaking about it, but I will stop there. If there are any questions, I'll be happy to answer. And I'm happy to stay for a couple more minutes. I don't have a problem.
Yeah, health economics is something which is picking up, and I don't think people are
Exactly.
really aware of it as an option. But we're forever looking at costs. We're looking at policies, how to make the policy to align with the cost. So, awesome. So there's one question which asks, is CGPA considered for direct PhD programs? And if so, what should the CGPA be?
So when I got into University of Houston PhD program, again, I have to say this with a caution there, because I did this in 2010. So CGPA is one of the factors. Again, I'm not going to deny the score or the CGPA, however you want to look at the score, is a factor. But having said that, when someone's going to look at your CGPA, for example, you have an 8.5 CGPA and someone's there with a 9.3 CGPA, it's not automatic for someone with a higher CGPA to get the admit, because someone with an 8.5 or 8 or even 7.5, doesn't matter where you are, you have that extra, for example, research exposure, or you have been part of a project and you have probably participated in a local conference, or whether it's a poster or a talk or whatever that is, or even you have published, right? So it's the combination of all things that you have done in your previous role and in your previous years that adds up to that PhD application. So CGPA is a factor, but if you feel you are lagging behind in one domain, that's even more reason for you to consider branching out to probably show your potential in some other domain, which is demonstrating research capabilities, demonstrating some experience and certification.
So I think that was all in terms of questions, Gopi.
Yeah, ma'am. Yeah. So I think I'm glad that I shared the questions from the audience beforehand.
Yeah.
You could prepare, and I truly I would say like this was one of the best Inspire programs so far we had, and we are very happy to have you, Dr. Arun, and we if there are any questions in the future, maybe I will try to connect with you through LinkedIn, or I will give the contact of yours to the participants. And as well, so Dr. Arun is sharing his
Yeah, I
contact
mean, I'll be
details, I
again,
believe.
I'll be happy to certainly help in any way I can, because as I said, someone did this for me, and this is exactly how I feel about the role that I am in. So please feel free to reach out to me if I can be of resource. Again, I'm not saying I know everything. At the least, I'll be able to point you to the person in the right direction, and maybe that person will point you to the real person. So it's all about utilizing your network and utilizing what we already have in our talent pool. And that's my contact in there, and that's my LinkedIn in there. But I really wanted to thank this platform, right? So Gopinath and the Acchutha Institute team, one, for really doing this for all the optometrists really across the country and sometimes even beyond, to show the real potential of having an optometry degree and then doing pursuing an optometry career. So a big thanks for this initiative to the entire Acchutha team. And certainly I'll be remiss if I don't acknowledge LinkedIn, which has really helped me. And thank you to the audience, because I think they took the audience poll, and they were really participatory. So thank you for participating. And thank you for patiently listening, because I think at some parts I just had to breeze through. So apologies for that, but thank you for listening to me patiently. And I really enjoyed the opportunity. So thank you
Yeah.
all.
Thanks,
Yeah.
Arun. And I have a big thanks to pass on to my team as well, because yes, we did come up with the idea together, but then the pursuing, following up, doing the work, behind the scenes, it's been done entirely by the team. I literally just show up for these meetings and listen to it and absolutely enjoy hearing what everybody is talking about. But, my team, I'm extremely grateful and feel very blessed to be in a place where I have a wonderful team to back me up. So thank you.
I think it's all the team effort at the end. So
Yes.
we can only run so far as an individual, and I think we
Very
can go
true.
far as a team.
Very true. Very true.
Yeah.
Thank
So
you.
with that, we will close today's session. And if you want to listen to it, maybe in a week's time, I will upload the same in our YouTube channel. You can again revisit and get more knowledge and insights from the talk. And I thank Dr. Arun for being a part of the program. And have a nice day, people, and good night, Dr. Arun.
Yeah, thank you. Have a good day, people.
Good night.
Bye.
Bye.
Thank you. Bye.